Hello guys, welcome again to our Krok series explanation, general medicine, and we're continuing with the year 2008. So let's start. In this question, the patient was having clinical signs of encephalitis and through a tick bite disease, and the hemagglutination inhibition reaction revealed antibodies that to the causative agent. So here we are having the virus and the antibodies. You can see here that we're having hemagglutination because of the interaction of the virus with the RBCs, but here, since we already have within the blood the antibodies formed, then the RBCs remain intact and we're having inhibition, hemagglutination inhibition reaction. And the doctor here suggested that we should take the serum and repeat the examination after 10 days because of the time that the antibody needs to get fully differentiated and produced against the disease, and then we can really confirm the diagnosis. So the 10 days will be here, and in this concentration of antibodies, we will really decide that the dilution or the titer will be higher, and it will help to confirm the diagnosis. To confirm that these antibodies are produced for the tick bite encephalitis. So in this question, we are having a patient noticing a reddening and edema of the skin areas. This is an example of the abscess formation during actinomycosis, and it is a focus of dense and yellowish green color. So the pus containing in these abscess contains granules, and these granules, histologically speaking, after the examination, had fungus, plasmatic, and xanthome cells, as well as macrophages. So xanthome cells are these aggregation of the macrophages here that have inclusions of lipids, and in the center here we have a lipid-laden formation of smooth muscle cells getting infiltrated with high levels or high amounts of lipids. The pregnant woman was having some drugs that affected the baby after giving birth, and it led to a genetic defect. So genetic, it means DNA defect. And the mutagenic effect actually is the chromosomal impairment or the DNA problems. This can be thalassemia, this can be sickle cell anemia, but for teratogenic effect, you can differentiate between these two through the malformations. This is a physical pattern that here in the mutagenic effect, that not really, it's just genotypic, but here it's phenotypic. So here we are having a wound that has been separating for a long time. This is a chronic situation, and the autopsy revealed the brown atrophy of liver and myocardium, spleen, and cross-striated muscles, and also renal amyloidosis. This is chronic sepsis, and you can see here the same pattern discussed in the question. Also, this is a long-term development. This is a chronic sepsis. This is a chronic sepsis, and you can see here the separations. For septicopyemia and septicemia, these are two different situations or two different diseases that we'll discuss in a separate video, and we will differentiate between these three cases. So here a woman, after giving birth, was diagnosed with a gynecological problem, which is chorioepithelioma, or this is a cancer problem actually. And here you can see the sponge appearance of these cells, and here we have plenty of these cells. As you can see, they are outgrowing and differentiating and dividing to penetrate the uterine epithelium. So this is the invasion state of the cancer. In this question, we are having an animal with aortic valve insufficiency and hypertrophy of left ventricle, also local contractures. This is because of calcium accumulation in the myocardiocytes. So the cardiac muscles will be triggered by calcium ions binding to the protein complex troponin, and troponin will active the binding sites to the actin. So when the ATP will come, it will attach to myosin and allow the muscle contraction process. This is a girl diagnosed with Adrenogenital Syndrome. This is pseudohermaphroditism. This is because of an adrenal hormone secretion or hypersecretion, which is androgens. This is a male hormone that is not normally, or it is secreted in the female body, but in low doses. But for pseudohermaphroditism, we have a high value or high level of androgens in blood that will cause the secondary sex characteristics to appear after the primary normal sex characteristics in a girl. So here they're asking about the stem cells of the red bone marrow. These cells, we can exclude the macrophages if they were asking about plasma cells, about neutrophils, basophils, eosinophils, even about platelets. We could go and differentiate them through the question. So another indicator will be cited here in the question. But since they are talking only about the red bone marrow, and macrophages are the only cells from these choices that are derived from the red bone marrow, then it's easy to tell that the fibroblasts are derived from the mesenchymal cells. The pigment cells are derived from the or melanocytes are derived from the neural crest. Lipocytes are derived from the mesenchymal cells, and pericytes are derived either from the mesenchymal cells or the neural crest. So in this question, we're having a 70-year-old patient revealing insulin-dependent diabetes. You may immediately think after reading the question that we should use insulin, but you should pay attention to the age of the patient. This is a type 2 diabetes mellitus. So we administer glibenclamide as it stimulates the insulin production. This is a sulfonylurease class drug. In this question, they are asking about how the human body will cool efficiently and with water, and which way of heat emission will be more efficient. It's heat conduction, because if we have contact between water molecules and human skin, we can get the most efficient way of heat emission. This is a pharmacology question. The patient is suffering from chronic cardiac insufficiency, and he was administered cardiac glycosides to be taken enterally, means orally, and you can tell from these that digoxin and strophantine and also core glucon. Well, core glucon and strophantine is the same, but digoxin is used for chronic cardiac insufficiency and it's taken orally. For strophantine is for acute cardiac failure or insufficiency in severe cardiac failure, and it's taken intravenously. That's how you can differentiate between these two cardiac glycosides. In the next slide, you can see the therapies used in heart failure and different drugs that we can use, and also the adverse effects of cardiac glycosides. Here, an ophthalmologist used mesotone for pupil dilation to examine the eye ground, and mesotone works on the alpha-1 adrenoreceptors to help in mydriasis by the increasing the contracture of the ocular eye muscles. Here in this question, we have a medical examination of a 36-year-old driver that after the working day, he hears ear noise, feels like indispositions, and he was diagnosed with essential hypertension. So the pathogenic mechanism is neurogenetic. Why it's none of these? Because these are physiological type of mechanism, reaction to this stress, but neurogenetic mechanism, it's actually phenotypic, because we can have another person in the same situation but will not have the same reaction. He will not develop hypertension. Maybe he will be very happy, but as the driver here is angry, means it's neurogenetically induced mechanism that led to essential hypertension. In this question, we have a trauma that caused ammonia generation to increase. And so the amino acid that will participate in the excretion of the ammonia from the cerebral tissue is glutamic acid or glutamate. So glutamate and glutamic acid is the same, it's just that glutamate will be reduced with some ions to give glutamic acid. So, but if we have accumulation of ammonia in the blood or in the central nervous system, we have a condition called hyperammonemia that can be described here. And you can see here that ammonia can only be used through this chain from alpha ketoglutarate to glutamine, and it will be processed and excreted, or it can exit the CNS. Here we are studying the cell again in the metaphase stage, because we have maximally spiralized chromosomes. You can see here in the equatorial plate that we're having our chromosomes in a very clear pattern, and this is the stage where we can microscopically see or even check the karyotype of the cell, because we have the chromosome in the highly and maximally spiralized condition. So guys, this is a microbiology as well as pathological physiology question where we had a tuberculin test and we had an appearance of a spot after 48 hours of 10 millimeters. This is a type of hypersensitivity. It's the fourth type. It's cellular cytotoxicity because it works through the T cell lymphocytes, and the tuberculin test actually works. The tuberculin test, this is an antigen called tuberzole. That's after this is a purified protein derivative that after its administration gets phagocytosed And this formation, the protein plus the macrophage, gives us an antigen presenting cells that activate the T cells, the T helper cells, and these T helper cells lead to the differentiation and to the activation of T killer cells that work on the destruction of the target cells. In this question, we will discuss a Meckel's diverticulum in an infant, because this is a congenital malformation of the GIT tract, and it's because of the binding or the band connecting the ileum with the umbilicus here. So the Meckel's diverticulum is the band from ileum to the umbilicus. So you can have no doubts with all these other variants. The next question is about the basal metabolism of a sleeping situation of a man where his power inputs are less than the basal metabolism. The basal metabolism is the metabolism needed to keep us alive, to keep us breathing and digesting. So if we have low nutritional inputs or power inputs, we're having even this light metabolism will be higher than, of course, if we put zero nutritional input, and this can be only in the state of sleeping. Here we are discussing a congenital problem for a newborn boy, genitalia. He revealed urethral hiatus that is opened on the downside of his penis. This is hypospadia, where you can see the opening of the urethra on the ventral down surface of the penis. So next question, we are having an injection of a solution full of sodium chloride to an animal, and this caused a decreased reabsorption of sodium ions in the renal tubules. So the aldosterone reduction is a result of the increased sodium in the blood. And if you can see here, the aldosterone is a hormone that helps to reabsorb sodium and as well as water to keep the level of blood or the blood pressure and also the blood volume in a normal level. And in case of increased value of sodium in blood, the value of aldosterone in the blood will decrease. So if we inject more sodium to the blood, as a reaction we have lower aldosterone level. So next question, this is anatomy question, where we destroyed the brainstem structures of an animal, and this animal lost its orientative reflexes, and also strong photic stimuli, means visual stimuli. This is because of the anterior tubercles of the quadrigeminal plate. The anterior tubercle can also be named as superior caliculi of the corpora quadrigemina or quadrigemina of the brainstem. The brainstem is here we are talking in the medulla oblongata level, but for the brainstem it consists of the pons, the cerebellum, and the medulla oblongata. In this question, we are having glucose oxidation impairment process because of dissolved metabolites that help in the glycolysis from glucose to pyruvate. So in the insufficient oxygen level in the myocytes, we're having pyruvate that is transformed into lactate here. We can remember from glycolysis that we have 1 ATP and NADH, but when we're lacking oxygen, we get to go from lactate to pyruvate by donating 1 hydrogen ion from NADH, and we with the help of lactate dehydrogenase, this hydrogen ion is donated to pyruvate and it gets reduced to form temporarily lactate. The next question. In this question, we are having a mother that during the period of her pregnancy, she was taking some antibiotics irregularly for an infectious reason. So her already 2-year-old child revealed some incisure destruction, yellow enamel problems, and problems of dental cervix. So this is a teratogenic effect, if we can tell through this clinical picture, and this is because of the consumption of tetracycline antibiotic doxycycline. These are the drugs that cause teratogenicity during pregnancy. You can exclude these three by remembering that furosemide is a loop diuretic, Ampiox is a combination between ampicillin and oxacillin, and these are both penicillin drugs. Xanthinol nicotinate is a vasodilator, and octadine is used for hypertension diseases. Next question. So in this question, we have a 59-year-old patient that after the tax inspection, he felt intense pain in his breastbone, and it was even irradiating to his left arm. But after 15 minutes, his condition came to normal. So the high catecholamine concentration in blood is responsible for the stenocardia situation. You can see here that the epinephrine, when it gets attached to its receptor, it detaches or dissociates the G protein to produce ATP from cyclase AMP, and we have an increased heart rate and all these consequences. So in this question, the patient already recovered from Sony dysentery infection, but was once more infected with the same causative agent. So you can tell from the classification of infections that the reinfection is the subsequent infection by the same organism even after recovery. And here you can read about Sony dysentery is a bacteria for the large intestine. So this is it, guys. Wait us in the next 25 questions, and we hope we really make things simple and we add more info for you to be able to solve more questions or even new questions during Krok by yourself. So take care and see you in the next video.